Most people worry about sugar, but there's another carbohydrate quietly slipping into our food supply that may be even more damaging. It's rarely talked about, it doesn't taste sweet, and it's often hidden behind misleading labels. I'm Doc Sharky, and after 20 years of treating patients in critical care settings, I've learned that some of the biggest health threats are the ones people don't see coming. This carbohydrate isn't listed as sugar on food labels, yet it behaves far worse in the body. By the end of this video, you'll know exactly what it is and how to avoid it. Before I reveal it, let's do a quick test. As I describe its effects, try to guess what this carb might be and comment whether this is new information for you. This substance is everywhere in modern food manufacturing. It's not technically considered food and not recognized as a sugar. Its main purpose is to bulk up products, improve texture, and extend shelf life. On its own, it has virtually no flavor, but its metabolic effects can be profound. In the short term, it causes sharp spikes in blood sugar. For people with diabetes, this can be extremely dangerous. Over time, consistent exposure may push healthy individuals toward insulin resistance and eventually type 2 diabetes. Still guessing what it is? This carb also promotes fat accumulation in the liver, increasing the risk of non-alcoholic fatty liver disease. When combined with preservatives and additives, it may contribute to kidney damage, blood vessel inflammation, and arterial narrowing. So what is it? It's processed industrial starch. Not naturally occurring starch from whole foods, but modified versions such as maltodextrin and cornstarch used extensively in ultra-processed food products. Why is this starch potentially worse than sugar? The answer lies in how fast it raises blood glucose, measured by what we call the glycemic index. Low glycemic index foods raise blood sugar slowly. High glycemic index foods cause rapid spikes. So glucose sits around 100 on this scale. Table sugar, which is also called sucrose, averages around 65, which is quite high. But maltodextrin, which is a modified food starch, its glycemic index can exceed 130. Cornstarch frequently ranks higher than sugar as well. So how can something that doesn't taste sweet raise blood sugar faster than sugar itself? Here's the science. Natural starches contain tightly bonded chains of glucose that take time to digest. This results in a gradual release of glucose into the bloodstream. Industrial starches are chemically processed to alter their structure. This weakens the bonds between the glucose molecules, making them extremely easy to break apart during digestion. Once consumed, these modified starches rapidly release glucose, overwhelming your bloodstream and forcing your pancreas to respond aggressively with insulin over and over again. In my clinical work, I've encountered many patients who struggle with blood sugar control despite strict adherence to medication and diet. While there are multiple reasons this can happen, the widespread use of modified starches can be an overlooked contributor. Another major issue is transparency. Because these starches aren't labeled as sugars, products marketed as sugar-free or low sugar may still cause major glucose spikes. They're also present in gluten-free foods and even infant formula. Beyond blood sugar disruption, industrial starches may also increase visceral fat storage, dry systemic inflammation, exacerbate arthritis and liver disease. They also disrupt the gut microbiome, which can increase intestinal permeability and potentially worsen inflammatory bowel disorders. Some are produced using aggressive chemicals, including bleaching agents. Despite this, oversight remains limited, leaving consumers responsible for protecting themselves. So what should you look for on ingredient lists? Look under thickeners, stabilizers, or fillers, including modified food starch, cornstarch, wheat starch, tapioca, or potato starch. Also, maltodextrin is a famous culprit. Dextrin, hydrolyzed starch, polydextrose, and artificial fibers. There is one exception worth mentioning, resistant starch, which may have potential benefits. If you'd like a separate video on that, let me know in the comments. I share this information based on real-world experience treating critically ill patients, something many online health influencers lack. If you found this helpful, subscribe and join a community focused on informed, evidence-based health decisions. Until next time, stay healthy, stay safe.